And welcome back to Fresh Living. What is a heart attack? What does it feel like? And what should you do if you suspect one?
Well, today we are asking the experts, and we have Dr. Kirk Knowlton here from the Intermountain Medical Center Heart Institute. Thanks for being with us.
Thank you.
For men and women, heart attacks are a little bit different, right?
They can feel different.
Right. Okay, so let's start with women.
Okay. So I think the important thing is that most of the time women have similar feelings to what a man would have, which is like a heavy pressure feeling under their chest or in their sternum area, maybe to their arm, and maybe up into their neck. But with women, it can present a little bit differently. So in some ways, it might just be shortness of breath, or maybe there feels like a stomach ache or something of that sort. So it's not quite as classic, but the symptoms are more similar than very different.
At what age should we be thinking this might be a heart attack? Or is there an age?
Well, that's a great question. I think most commonly it's people who are 55, 65 and older that have heart attacks, but occasionally it can happen to younger people, especially if there's a family history of heart disease. Then you have to be more worried about it, and if there's a history of high cholesterol, then at a younger age one should worry about it.
Now, this might be a stupid question, but we hear all the time with strokes, if you suspect you're having one, like, get to the ER immediately.
Right.
You know, that'll have long-lasting effects otherwise. Are heart attacks the same?
Exactly the same. So, you know, one of the common questions people have is, I have chest pains.
Yeah, it's a heartburn, is it a heart attack?
How do I know if it's
Right.
a heart attack? And it's hard to tell. There can be mixtures of them, of the symptoms, but again, it's that heaviness. And then if the pain lasts for over 15 minutes, is not going away, it's better to be safe than sorry. And so you want to get to the hospital as quickly as possible, because once you're there, it can be treated within 90 minutes and resolved in in most cases. Often it's the delay in getting to the hospital that's the is the hardest part, because people just don't know whether I should come or not. So play it safe is the smart thing to do.
Now, to lessen the chances that we get a heart attack, what should we be doing?
Well, that's a great question as well. There are a couple of what you shouldn't be doing. Smoking is probably one of the greatest risk factors that you can control. And then other things that can help reduce your risk is to eat healthy diets, exercise, pay attention to your cholesterol and your lipids, especially if you have a family history of heart disease. Then you want to be really, really careful in that regard. So I think those are some of the basic things that we probably all know, but have trouble keeping up with.
But we have experts standing by right now.
That's right.
The phone banks are open, so if you have a question for a professional, you can give them a call. The number is 1-877-908-0680.
Thank you so much.
That's great. Thank you very much.